Thank you, Dr. Saxena, for that excellent talk on exercise. I just had a quick question. So, when you use your remote, like let's say I use my remote often, is that something like, do you count that as exercise? Like, could I cut maybe 10 or 15 minutes off the cardio? We can talk about that later. Anyway, so what we're going to go over now is tackling common cardiovascular conundrums, venous insufficiency. So let's talk about this common complication that we see in our practices, venous insufficiency. And what is the functional medicine approach? So if you look at venous flow, if you look at blood flow, you look at the heart will pump blood to the arteries and the arterioles. The arteries and arterioles will pump to capillary beds and venules. Venules will go to veins. Veins will then move the blood to the subclavian vein, and the lymph ducts will also drain in the subclavian vein, and the subclavian vein will then go into the heart, and then the process continues and it circulates. Now, the big difference between veins and arteries is that arteries have muscles within them, and the muscles actually will contract and they regulate blood pressure and they help keeping the blood flowing. But veins do not have that luxury. Veins will depend on our own muscles, our skeletal muscles around them. And if we're contracting them a lot, we're helping with circulation. So what happens is that being active and moving around and flexing our muscles will keep the pressure up in the superficial system to about 20 to 30. And then when it starts going to the deeper system with the valves, what happens is that the valves will stop blood from flowing back. So the blood can only go one direction. And that is basically to have a healthy venous system. You want to be exercising often, and you want to have that higher venous pressure and flow. So what is the pathophysiology of chronic venous insufficiency? You have incompetent valves, or you can have incompetent valves. You can have thrombosis, and you can have obstruction. And that can lead to elevated venous pressure. Elevated venous pressure can lead to vein dilation, skin changes, and ulceration, but also elevated venous pressure can make worsened incompetent valves, worsened thrombosis, worsened obstruction, and then you get this vicious cycle, and usually it's the lower extremities, they end up getting worse and worse. So if you want to look at the contributing factors, take a look at the functional medicine matrix. Basically, venous insufficiency's pathogenesis really hits many of the places on the functional medicine matrix, multiple places that we can look at. So what are the clinical manifestations of venous insufficiency? Well, the symptoms are limb itching, heaviness, fatigue, particularly in the legs, pain in the legs, swelling and tightness. The skin can get dry and irritated. So if they have this dry, irritated skin, you might not be dealing with autoimmunity. You might actually be dealing with venous insufficiency. They can get muscle cramps. So your muscle cramps might not be a magnesium deficiency. Your muscle cramps might actually be venous insufficiency. Pain worse when standing or when seated with their legs dangling. So when you're sitting, the legs are dangling. And the pain improves when you elevate your legs and walk. And that actually can differentiate from arterial insufficiency. Remember, in peripheral artery disease, in arterial insufficiency, you get claudication. That's when you walk and you exert yourself. And because the blood vessels going to the muscles in the legs are tighter because of atherosclerosis, what happens is you get pain from walking. Whereas venous insufficiency, the other side of the system, you walk and you actually start to feel better. Why? Because those muscles are pumping the veins and they're moving blood through instead of the blood just being stagnant and sitting there. Now, the diagnosis is usually made by clinical signs and symptoms. So the clinical signs, what are the signs to look out for? What I recommend is that for this part, when you reread your notes, go to your favorite search engine and look up every one of these things so you know what it looks like. I'm sure you've seen it before, but just remind yourself what these things look like so that it can help you. It can help you when you're diagnosing your patients and looking at your patients. So edema you can get, which is swelling. Stasis dermatitis, which is a dermatitis. It's red and it's swelling and it's inflamed. varicose veins, which we can see in this picture. This person has some varicose veins. You can have lymphodermatosclerosis, which is the champagne bottle sign. When you search that and take a look at that, and you see how the leg will look like a upside down champagne bottle. Why? Because there's a lot of fibrosis and hard tissue, and that tissue is holding, you can't get it much edema, you can't get much swelling because it's so tight, the blood can't move in there. So look up the champagne bottle, like not just regular champagne bottle, but look up champagne bottle or lipodermatosclerosis, and you won't forget that image. When you see it, then you won't forget that image. You can get ulcerations because there's decreased blood movement, so you get ulcers. You can get hyperpigmentation. We see this a lot, where you have a darkened color of the skin in the lower extremities from the constant fluid or blood that's just kind of leaking in there. That's that's hemosiderin deposits or iron deposits from popping blood cells. And you can get skin atrophy. And that's where just type in venous insufficiency, type in these things with venous insufficiency next to it, and then just make sure you have just a really good visual on what all of these things look like. So what is the functional medicine treatment plan? So we're going to want to take a look at the risk factors of chronic venous insufficiency, and we're going to want to look at the ones that are modifiable. And based on that, we can give patients recommendations and plans. So obesity, work on decreasing fat. Sedentary life, work on being not so sedentary. Check estrogen levels, check hormone levels, and work on decreasing the estrogen and increasing progesterone if you have to get out of that estrogen dominance. What we want to do is take a look at those risk factors and see which ones are modifiable and start working with them. So you have this person with venous insufficiency. All right, obesity. You work on lowering their body fat. Sedentary lifestyle, work on getting them moving. High estrogen states, check their levels, check their hormone levels. If you haven't been to the IFM hormone module, check it out, because it has some really good information on how to balance hormones in a functional medicine way. Prolonged standing, make sure that they're not standing for long periods of time. At least they sit, or they every so often they're walking around. You can have them set a timer. So every so often, maybe every 20, 30 minutes, they're walking around to keep keep moving. Work on cigarettes and work on decreasing smoking and mentioning, look, this is a risk factor. This can be worsening your venous insufficiency. Other conservative therapies, leg elevation, so have them lay down when putting their legs up to help, like gravity will help push the blood down. Compression therapy, so have them wear compression stockings and whatnot. And with stasis dermatitis, sometimes you got to use some of the topical dermatologic steroids and some of those agents. And that would be, and that can be helpful there. You may consider earthing. There was research that showed that if you put your feet on the ground, on the outside ground, not in the insulated houses that are up high, not wearing shoes, maybe wearing socks or barefoot, then what can happen is the viscosity of your red blood cells or of your blood will decrease. So the red blood cells will clump less, and you can have better movement, better circulation. Pharmacological therapies and supplementations to target venous insufficiency. So what can we do? Well, we're looking at doing two things. We want venous tone to be improved. So you want to tighten those veins up. Arteries, you want to loosen up the arteries usually when they have hypertension. Veins, you want to tighten those bad boys up so that circulation can happen. And then you want to improve the flow. You want the blood to be able to flow through the veins better. So let's take a look at venous tone. This is one of the places where really we're ahead of the game in a functional and integrative medicine, because if you look at the conventional literature, even like UpToDate, so many people are using UpToDate now, and put in the chat box if you use UpToDate. Just mention, do I use UpToDate and how often and whatnot, so we can take a look at that. But UpToDate, if you take a look, what can you do for venous tone? It has two supplements. You have this whole thing about, oh, don't use supplements because supplements we can't verify the source and whatnot. But then when it comes to venous tone and increasing venous tone, two supplements: horse chestnut seed extract, and there's your dose, and the diosmin. So those are the two things that are mentioned And we in functional and integrative medicine, we are more prepared to deal with this because we know about pharmacy grade. We know about giving them good product that is not going to have, that is third party tested and doesn't have those toxic fillers and whatnot. The second way of giving therapy or of treating this from a medical point of view is going to be improving venous flow. You want blood viscosity to be more thin. You want blood to not be as prone to clotting so that the blood can flow easier. So here are some agents you can use. You can use aspirin, you can use pentoxifylline, you can use nattokinase. And where would I think about this? Well, nattokinase can help lower fibrinogen. If you remember the first talk on day one that I gave, that we talked about elevated fibrinogen as being a risk factor. Well, nattokinase can help lower that. So if they're not on aspirin or any blood thinners and they have high fibrinogen and venous insufficiency, that might be a good one to put somebody on. Omega-3s also. So omega-3s, we're trying to get their omega-3 levels up. I hope by now you realize that omega-3s are useful. So at least just optimizing your omega-3s can help with the venous flow. You're going to have people that are going to come and see you and you're going to be treating them for other things. And because you're functional medicine, you're part of the cool club, what's going to happen is they're not even going to tell you about their venous insufficiency, and it's going to get better just because of the treatments that you're doing. And it will be, and it is epic. And what if all else fails? Then you refer. So in conclusion, I would like to end with some hashtags. Hashtag take care of your veins. Hashtag functional medicine rocks. Hashtag thank you very much. I am hip. You see that now. Hashtag Dr. E is all right. Thank you.